It's 94.7, BlairRadio.com, our local guest segments and nonprofit news brought to us by RVR Bank. And today we have Three Rivers Public Health with us, joining us, and a couple of new faces today. So if I could have you guys introduce yourselves.
Evelyn Martinez, lead community health worker.
And
Sarah Brumfield, community health educator.
all right. So how long have you been with Three Rivers Public Health?
I've been at Three Rivers for 11 years now.
Okay. And what capacity?
So I am the lead community health worker, and basically my role is to be the bridge between the community resources and the community's needs. And so I'm out and about a lot within the community in educational events, screenings, just pretty much anywhere where I'm able to be at, I'm there. Like just recently I did a whole bunch of breast cancer awareness education side. So I was at LPP, I was at Hostones, just promoting and doing the awareness to the community and just being that connection between the resources and the community.
And so you find that things come up and you have to put together the program and go out and implement it.
Correct. So that's pretty much how community resources, or how we work, where we find the needs and then we try to create a plan, create a community that is going to support that plan and then implement it. So for example, right now we're doing the community health initiative, and so we're just trying to the minority health initiative, we're just trying to bring more resources to that community in itself.
Sure, and that community is growing.
Yes,
very much so in our areas. So, that's a great place to put a lot of resources.
Yes.
And introduce yourself again, Sarah, right?
Yeah, Sarah Brumfield. I just started. This is my second week. I'm very excited to be working with Three Rivers. I have a background mostly in sociology and like health equity and health disparities. So my role, I'm a community health educator, and I will be working a lot with the data and the numbers. I know that's kind of like the less interesting part for a lot of people.
Well, somebody has to do
it. Yeah, because we need to see, what are the needs in this area? Where are there gaps? Because a lot of our funding is from grants.
Exactly.
And grants need to see those numbers to see, why do we need this program in the first place? Is the program helping? Yeah.
And then you have to do the follow-up with the grants to prove that you did with the funds that you did. Exactly. So somebody has to, that's actually a big job right there. So
it is, and I'm the kind of nerd that enjoys that kind of stuff.
You enjoy that. I can find a lot of things for you to do. Anyways, so you guys are here today to be able to talk about kind of what's coming up here. Now, we are in a new season. The weather has been weird, so we don't know what the flu season is going to be like. That's something that is continuously being researched. We don't know what else is going on. So you guys are in the middle of trying to figure out everything coming up. What are some of the things that as needs or things that you are working on going forward?
So one of the things that, with all these new things going on with like trying to be ahead of flu and COVID and everything, we tend to forget about those things that we've already been trying to work with, which is like lung cancer or men's health or diabetes. And so we try to also promote that as well within all the new stuff that we're trying to bring, which is like the flu and the COVID and RSV.
The headlines override a lot of the things that really need some of the basic things. We forget about basics, so that's what we need to talk about, isn't it?
Yes. So because you are going to hear it everywhere. Oh, COVID, oh, RSV, oh, flu, or the other shingles is one of the things that's really promoted. But we tend to forget about how important it is for the males to go get their annual exam and get their testicles examined and just get all that workup that they need, because they also need labs to make sure they're not running high cholesterol or their blood pressure is high, or your pre-diabetes. We're trying to promote prevention versus already having the illness and then trying to attack.
Right.
So we try to get you where you're either pre-diabetic or like getting there, so we can start an action plan and then decrease your chances of even being in prediabetes mode.
Because being a man, we like to say, we're fine. We don't need to go through that. Sometimes no news is good news, right?
Yes, yes, I do get that a lot. I don't want to know. I don't want to go because then they're gonna tell me all this and that, and so it's very important for to promote that. Because there's such a, like, I don't know, a stigma or something that they are the sole providers and they don't need care. Yes. Mental health and just overall health in men is very important. And so that's one of the things that we're trying to promote. And it comes along with, the diabetes prevention and everything else. So.
And so do you have clinics or things coming up to be able to really start getting out and having men or everybody but men go out to be a part of it?
So December 9th in Fremont, we're going to have a big resource fair. Okay. And that's like an overall community resource fair. We're going to not only health, we're going to have like, if you're in a financial need of something, or if you're in the need of some legal advice or something, we're just going to have all our local community resources in one place where people can come in and just ask questions, potentially get a link to an appointment or things like that. We're going to have a screening bus where anybody over the age of 19 can come in and get the screening for free. And so that screening is for diabetes, and it's going to have, a blood pressure check. And so those numbers are just so very important to know.
Right.
You want to know your blood pressure, your normal blood pressure, your diabetes numbers, your cholesterol numbers. If you keep those numbers within the normal range, you're healthy. You're being able to decrease any other illnesses.
Well, and healthcare is expensive enough on the way it is without having to be behind the curve. Right. If you're ahead of it, that always helps monitor it. But also, if people, men, everybody get involved and go and do these things, you get these numbers that you can shift over to her to get grants.
Yes.
To be able to help subsidize or to be able to make it more affordable for everybody involved.
Correct.
That's kind of the way it works, right?
Right. Yeah. So we do the work, but then she turns in the numbers and proves, that the need is there. But we need we need her magic. Because I'm not doing it.
Right. But as the numbers change and everything like that, it is a moving target. So you kind of have to do an estimate at first to be able to start it off at some point, right? And so now obviously there's been grants and stuff like that. There's a history already that you're stepping in and learning. What is the biggest trend? Do you see something growing, that a bigger need for grant approval?
I think right now one of our biggest needs, just based on, so every 3 years, all the local health departments in Nebraska do a community health assessment. And so it's asking the people of whatever county or counties they serve, what are the issues that you're seeing? Is it like diabetes? Is it obesity? Is it substance misuse? Is it behavioral health, mental health? And it seems to be a trend right now that behavioral mental health, I think, because there's still such a stigma attached to it.
Right.
And in Nebraska, it's really hard to find places to get the help that people need. And so I think that's a big one coming up that we could probably do more with. And it's just getting the awareness out there that there's resources for people and just trying to work on breaking that stigma.
So when you come across that, you obviously can't do it yourselves. Three Rivers Public Health as an entity can't do everything. So you partner with different places. Is there partners in this area that you really rely on to be able to get some of this stuff done?
So yes, one of our major partners is our local providers, medical providers in our hospitals, and then we also partner with Lutheran Family Services, which is a major provider for also mental health, and so we just try to, like I said, link those resources with us and therefore with the community. So if we learned of any new resource, we tried to make that collaboration so that we just bring on more forces, to be able to work together.
All right. And so if somebody has questions, they want to get involved or they want to be able to see these resources, what's the easiest or best way to be able to do that? You guys are always trying to make it as easy as possible because well, we all know if it's a little difficult, a lot of people give up. So
Yes.
how do you get to that point where it's nice and easy and people can find that?
So we've made it to where if you call us, there's 2 community health workers right now with us, which is myself and then also Nayeli Rodriguez, and we're both bilingual, and we're pretty well aware of most resources within our 3 counties, which is Saunders, Washington, and Dodge. Anytime you have any question, and that doesn't even need to be like health related. It can be, like I said, rental assistance, utilities, legal. We try to get you connected with the correct person, right, or organization. And so, and if we don't know, we look.
Right.
And we try and we connect and we build a good community where we can reach out, via email, via phone, and say, hey, I have family in need. This is what they need. And then, you start getting these, there's this resource over here. There's this person over here. And then that's how we connect. So
that's a great reminder right there that even if you yourself, now there's a lot of individuals that need help. And if you do need assistance, don't be afraid to ask.
No.
But if you see somebody else in need, don't be afraid to step out and ask for them. Community helping community, right?
Yes, that's the model that we're trying to push. It's like, together we can do this, and we can break those bases that are creating all these needs. And if we don't know, we can't help.
And it builds the infrastructure in our own communities to be able to take care of ourselves and not rely on a bigger structure to do that for us, right? Because we don't want things dictated 100%, correct? So again, it is the community within ourselves to be able to do that in the infrastructure. And you guys are working really hard to do that. Again, December 9th is the clinic that's coming up. And so we'll get details on that.
Correct.
It doesn't seem, it's like, wow, that's so far away, but really it's only a couple of weeks away.
Yeah.
Do you guys have a lot to do to prepare for that yet?
Yes. And it's almost, I don't want to say we work better under pressure, but it's almost like, a thing that
all of a sudden, we're 3 weeks away.
Yeah.
Whoops.
So, but it's the fact of bringing this to the community that makes us motivated. The fact that we can, it's the end of the year. So the way we looked at it was, it's the end of the year. Let's pack them full of resources. So when the new year starts, they're on the right foot, if you want to say
everybody
it like that.
has given the resources and the directions to be able to move forward into the next year.
Correct.
Make those New Year's resolutions easier as well, right?
Right.
So everybody wants to have a healthier life or things like that, and that's what you guys are here to be able to do is help find ways to do that and help be able to make it affordable for everybody as well.
Exactly.
That's correct.
So okay, and so again, the best place to go to find the things you guys are working on is your website, right?
We have different ways. We have the website. We have a Facebook page. We try to be like at the radio station, the Fremont radio station. What else? Call us.
Yeah.
If you see us, ask us.
Yeah, Facebook and the website will be the best. One thing that I'm going to be working on a lot too is really kind of updating our website and getting it a little more accessible for people, and also having a list of those resources too, because especially if you're new to the area, you might not know, like, oh, I need a dentist appointment. Who are the dentists near me, or where is an urgent care, or that kind of thing. And then on the Facebook, what I want to do is, since I have that data, I have those numbers, is make it really relevant for people in the Three Rivers area that, if we're sharing a post about lung cancer, well, I don't smoke, I'm not going to get lung cancer. But if they see, like, this is the rates of lung cancer in these areas, there's that more personal connection for people. So really trying to make it more relevant and local when I have all these numbers and we're sharing all this, National Awareness Month information.
Right. And so now I'm going to throw a question at you, and if you don't know the answer, don't worry about it, because Three Rivers Public Health starts in Fremont, has grown into Saunders and Washington counties and stuff like that. Fremont, obviously, the largest community in those areas. So it takes more resources to be able to go out into Wahoo or to Blair, to Herman, to all these communities. What would it take to be able for you guys to be able to grow and feel comfortable saying, okay, we can go this time at this place, these different places, and meet people where they're at? Because it does take a lot where people come to you to ask them to come to you, but sometimes it's a lot easier to go to them and they'll actually respond better.
And we've tried our.
No, I'm saying you're getting it, but it takes resources to do that. And there's a limited amount of people that you have. So what is it that people can do to help you guys grow to be able to reach out more?
In my experience, it's the attendance. To be able, because I need to be able to prove, or not, like I need to be able to give her
the numbers
saying we need this as a community, and therefore she does her magic, and then we bring it up to the state or whoever we need to bring it up and be like, first show you that there's a need in our community, and therefore we get that grant money. So when we try to promote events, just being there and showing up, and just so we can show that there is a need in the community, and then talking to us, letting us know, hey, we think this is something that community can benefit from. We're always open to ideas. Like she said, we do every 3 years we do the community, and that's open to the whole community, and we try to get as much input as we can from the community. So doing those when it comes around, because it's every 3 years, it just helps us demonstrate that what we're trying to do is valid, that it is needed. And so showing up to the events, letting us know what is it that you think, because sometimes there's pockets of community that we don't even know they're there.
Right.
And so
that's the whole point of that is having people step up and be heard. Then that way the community and everybody can be able to encourage or to be a part of it.
Yes.
So, because some people are like, well, I want people to stay away, but everybody needs somebody, right?
Yeah, I think it's just that community buy-in of if it's not like, you may not necessarily be impacted by a certain thing, but someone is, or your neighbor is. And if people are willing to come together in this and say, this person I know could use this, or my friend just got diagnosed with diabetes, they need a lot of help. And just having that community buy-in, I think, is a huge support that we could use, because we're all in this together, be cheesy.
And as an entity, you're not here to take away the power control. You're trying to give it back.
We're trying to give it back. I think that's one.
That is really something that when people say, well, look at some things, it's like, oh, we want to make sure that we don't have our rights taken away. No, you're trying to give it.
Yes.
So trying to give that buy-in or be able to give the education to people.
Yes.
And so that's...
So one of the major things that we try to promote is we empower communities. And so what we're here is just to give you the tools that you need. Yep. And eventually, that the community is the one coming together and running this and bringing it up. And we're just a tool. We're just a guide. We're the Google search.
You're the interpretation of what's coming down the pike. You're not. And so then that way people can be educated and make those decisions.
Yes.
So, well, thank you very much. Is there anything else you guys would like to talk about? I threw a few things at you, but...
Oh, I guess one of the other things was making sure that they know that they can come and get the radon testing kits at...
Oh, yeah. And that's a big deal here in Nebraska.
Yes. I know sometimes it's like, oh, we're fine. We don't have any issues. But it's not. It takes a while for it to show up. So just having those radon testing kits done in your house is very important. And I think there's, I don't know on top of my head what locations here in Blair have them, but there's a few locations here in Blair that have them. I think the City Hall has them.
Yeah.
Otherwise,
sure the fire departments do.
Yeah, maybe so. Otherwise, Three Rivers has them for $1, and if not, they're like $15-$20 at the store, but it's just important to have that test done. And because the radon causes cancer, and that's if we can prevention, avoidance, longer life, better life. Yes. So
again, thank you, Three Rivers Public Health, for coming in and always sharing what's going on.
Thank you so much for having us.